Hello, my name is Joe Ciampelli. I am the Vice President of Entertainment Project Services. Welcome to our presentation of a case study on getting back to work during COVID-19. Joining me today are Molly Michelman and Eric Rouse. Molly is the Executive Administrator for Entertainment Project Services, and Eric Rouse is our Director of Rigging and Training. We're going to take some time today and discuss what it's like to work backstage during a pandemic. So working in this new time is very different than what we are used to. One thing we've learned in the past 4 months is that we have a lot left to learn about this virus, this pandemic, and a lot left to learn about how we get back to work safely. This includes how do we keep our people safe? How do we keep our employees safe when they're working, trying to social distance in a work environment? How do we keep our customers safe? How do we keep their employees safe and the public safe? What is travel like during a pandemic? How do we get back to work safely? How do we limit interactions to a tolerable level? This is really a process of risk assessment and risk reduction. That's a term that we use all the time when we look at mechanical design and systems design when we work on our projects. But risk assessment and risk reduction has taken on a whole new meaning with this pandemic. But it really is what we're talking about when we talk about wearing masks or washing our hands diligently and using hand sanitizer. We're reducing that risk that we're going to contract the virus. Lastly, so Molly is going to speak about how we plan for travel and how we plan to keep everybody safe while working. And then Eric is going to take us through what it was like to travel and what it was like to be on a job site practicing social distancing while working backstage. With that, I'm going to hand it off to Molly, and she can talk about the planning stages in getting back to work.
Thanks, Joe. So when we were thinking about traveling, of course, we wanted to make sure that anybody who was going to travel for us really understand and knew the basics of keeping their hands clean, using hand sanitizer, avoiding touching their eyes and nose and mouth, avoiding close contact with other people, wearing face coverings, and making sure, of course, that every part of their trip they would have access to the things that they needed to make sure to take care of all the basics. We wanted to think about, for ourselves, what were the policies that were going to be important here? What were our clients' policies? What would they be expecting of us? What would they be requiring of us? What kinds of questions might they ask? And what did we need to be prepared for? Then, of course, we developed our own policies, and we have travel policies already in effect just for normal circumstances, but what were the things that we had to think about, again, to keep ourselves safe and keep our clients safe? And then incorporating the government guidelines. We spent a lot of time looking at what the CDC and OSHA was saying and what's changed all along the way to incorporate into our policies. One of the things that really came up from the CDC that we have continued to think about and thought about a lot before we send anybody out to travel was anticipating needs. Little things that wouldn't seem so important, like making sure that our travelers had food and water all along the way. Maybe restaurants wouldn't be open, maybe the hotel bar or snack shop wouldn't be open, limiting the number of stops along the way for those kinds of things. So thinking about having enough medication in case they had to stay wherever they were traveling, making sure they had enough clothing or that there were going to be laundry facilities at the hotel, all of those kinds of things to help make sure they'd be okay and safe all along the way. Obviously, using all of these guidelines that we had looked at and thought about to protect themselves and then protect the client and their coworkers while they were on site. And then some specifics for transportation and lodging. And we'll look at that on this next slide. So in our specific case, we had more than one traveler. So they had to all travel in separate vehicles, again, to reduce the risk of transmitting the virus in the event that maybe they had become infected and they didn't know about it. So we wanted to minimize that. Having enough food and water for the road, hoping that they'd be able to limit stops along the way, packing enough hand sanitizer. And again, if somebody had to travel but wasn't going to be able to check a bag or would prefer not to check a bag, making sure to have the right sizes of hand sanitizer. And of course, booking accommodations in advance. Sometimes we're a little more laid back about that. Maybe we're going to need to stay over. Maybe we won't need to have the extra day, but making sure that that was all set in place. And Eric will talk more about this, but looking for, and this is something we're continuing to think about with travel, looking for partially full flights to avoid our travelers having to sit really close to anybody. And Eric will talk a little bit more about how upgrades might play a role. And then if you can, yeah, thanks for the next slide. In general, we're starting to realize, and we did this in advance too, that we have to not just think about where we are located, but where the travelers are going and where they might fly through. What if they're flying through and they have to stop in a city and the restrictions and guidelines are different there? Or if they're driving through different states, what might change there? So knowing those in advance and following any guidelines and any restrictions. Of course, using the same steps for everywhere they go, washing hands, wearing face coverings, etc. Cleaning and disinfecting all the high-touch surfaces. Eric will talk about that specifically on the job site. Bringing along cleaning supplies. We sent a little bit to our travelers, and then we've kind of modified that even more so. Looking for hotel rooms with a kitchen. This was something that Eric really recognized when he went out to travel, what a benefit that would be, especially when you're staying for more than one day. And of course, hotel services aren't quite the same. As I was saying earlier, maybe the snack bar isn't open, maybe where you would sit and have a drink or have a meal late at night. Not all of those are available or open. The breakfast buffet isn't there. So making sure that the travelers had something to eat and a place to prepare it. And then again, if somebody is going to travel and be in a location for a longer time, maybe they're going to feel like, and probably will need to change their clothes the next day, but maybe if you only pack a couple of work shirts, you need to be able to wash those in between, again, to avoid transmission. But also, what if somebody got stuck in a location and they need to be able to wash their clothes? This is a picture of the items that we sent to the travelers in advance. You can see we've got wipes, like disinfecting wipes. We've got small hand sanitizer, a couple of different kinds of masks, and we'll talk about that a little bit more. Some non-perishable snacks. We even we didn't realize this on our first trip, but we realized it after travel that it was important to have dish soap and a sponge for cleaning dishes, especially if you're in a location that doesn't have a kitchen, and gloves, and then some little extra baggies for just anything like a mask that you might want to keep separated. So Joe, I'm going to hand it back to you for our next part.
Thanks, Molly. I'd say the one of the big things that took me by surprise was planning for extra medicine. And what happens if you are stranded on location, or you fly somewhere thinking you can come back, but then all of a sudden there's a 14-day quarantine lockdown, and you want to make sure you're prepared for all of these essentials. So thank you for walking us through that. So what was it like to travel? We've all heard about empty airports, but so far I haven't been in one. Eric had the pleasure of breaking that ground for us at Entertainment Project Services, and I'm going to hand it off to Eric to talk about what it was like to travel.
Yeah, thanks, Joe. Travel was different. You know, this picture is not unusual for us. You know, we're all used to wearing masks, and that's not uncommon. But what was not common was getting on the rental car shuttle, you know, and having to wear a mask, and being worried that the rental car shuttle attendant was going to help shuttle your luggage into the van, and you know, not everyone was wearing a mask on the shuttle, and things like that. And then once you get to the airport, if you go to the next slide there, once you get to the airport at this point, and I'm assuming it's changed a little bit now, it's probably a little more populated, but it was deserted. There was, you know, I've never seen the TSA checkpoint look this vacant ever in my entire life. Honestly, not even when the airports were opened after 9/11 had I seen it like this. So that was really shocking to see it like this. And then if you go to the next slide there, Joe, you know, nothing was open. So if your habit is to, you know, go to the airport and, you know, have a cocktail to calm your nerves before a flight if you don't like flying, or if it's you're expecting to get there and have something to eat before you get on a plane, at that point you just couldn't, it just wasn't an option. Literally nothing was open. Again, I'm assuming maybe a little bit more is open now, but it's something that you should plan for, maybe taking more snacks and things like that to tie you over for, and not have to worry about getting stuff at the airport. So yeah, travel was definitely different. And then on the plane, and this was where the conversation of upgrades came up when we started discussing this. As a frequent flyer, I have a pretty high status, and I got upgraded because of course no one's flying. And I realized that everyone's getting upgraded because no one's flying. So people in first class were really close together, and people in coach had a lot of room. So perhaps maybe next time I don't take the upgrade so that I can just have a lot more space to myself. You know, I hadn't really thought that through at the time. A lot of this was trial and error. Go ahead to the next slide, Joe. And then the job site was completely different as well. So we're used to working very close together. We're used to just doing what needs to get done to get the job done. And we were actually working in California, where, you know, they were still very high up on the restrictions. They hadn't moved to any of the phases, actually like now. And the having to come up with a plan for work there was some logistics to it. So first of all, obviously masks was mandatory. That was part of the client's precautions, and that was also on our list. So we were definitely wearing masks. And then, you know, prepping for work, we had to do things like cleaning the tools. We had to make sure that we had table space so that people could be away from each other. You can see the canister of wipes sitting in the middle there, that every day when we started, we would clean off tools. That was some new things that I had brought, these tools that they're cleaning up, but, you know, we just cleaned them up anyway. And wearing masks while they're working. And if you go to the next slide there, Joe, we actually, as part of the work plan for this, said, you know what, we have a lot of stuff to do up high. We're going to need a lift for each person. You know, we're not going to do what we would usually maybe do, is rent one lift and have one lift for two people. We just weren't going to do that. So we had to be socially distant while working as well. So we ended up renting two lifts so that people could be working across the stage, you know, across the stage from each other instead of really next to each other. And that worked out very, very well. Let us continue the work. And we found other ways to be separate. You know, what I noticed as the lead on this job was having to figure out how the day went kind of was based on how do we do the work, still get it done on time, but maintain all of our precautions and be socially distant and be aware of our spacing to everybody. And there was other work going on in the venue as well, so we had to be cognizant of that. So really completely different mindset on this. And then at the end of the day, you know, we had to consider, all right, should we clean the tools? And we did. And, you know, for the most part, we cleaned the tools. We would wipe down the lifts, and then we would wipe down the lifts when we started the next day. We also did things like people had their own lift. You know, when they got a lift, that was the lift that they used, and they didn't switch, just to take a further precaution. So very different, very doable though. I think with planning, I think that's the point here, right? With the correct planning, I think we can still do the work with the correct precautions in place, still do the social distancing, still wear our masks, still take precautions that can keep us healthy on the work site. So I absolutely think it's possible for probably 90% of the work that's out there.
Great. Thank you, Eric. Thank you, Molly. That concludes our presentation. We encourage you to practice social distancing, wash your hands often. If you're planning on being on site, check out the guidelines, government guidelines, CDC guidelines, and plan ahead. It is possible, and we look forward to getting back to work with everybody in our industry. If you have any questions in particular about the plan that we put together, feel free to email us contact Molly at the email address on the screen for additional information. And again, thank you for watching.
Thanks, everybody.